Hey everyone, it's Nurse Dani coming to you live, and we have a special guest with us today, Reva Cook, and she's a licensed clinical social worker who specializes in maternal mental health. And we've talked a lot about postpartum depression in the past, but you're going to give us a different perspective on it, and like the fact that it starts way before the postpartum period. And so we'll get into that in a minute. But introduce yourself to everyone, Reva, because I think everyone needs to know how great you are. Our paths have crossed a lot, and you have a passion for this topic. I do too, and you've done so much to help women in Utah.
Oh, thank you. Yes, our paths have crossed because we both share this passion. And I'm a licensed clinical social worker with the Healing Group. And I, as you said, I specialize in maternal mental health. And that is a huge spectrum of things, ranging from before babies are born, all the way through the lifespan of being a mother.
Raising kids is not easy.
It's not. And then there's the whole, my kids grow up but I'm still a mother. So that is my passion, the whole span of motherhood. And you and I have talked a lot about dealing with the period of pregnancy and postpartum and all of the things that can happen in that, wonderful and challenging.
That's a very wonderful and challenging time for sure. So perinatal mood and anxiety disorders. Define that a little bit for everyone, because that's what we're going to be talking about. And I want people to understand what it is and be able to recognize signs if they're experiencing this, and then know what they can do to get help.
Yeah. So that's kind of the umbrella term. We talk a lot about postpartum depression, and that is one thing. That is one particular type of illness. And it's referring to a specific time period, the postpartum period, and to a specific illness, depression. And the term perinatal mood and anxiety disorders kind of helps us remember that we're talking about something much bigger. And the term perinatal refers to the period of pregnancy and the first year after birth. And it encompasses everything in there. And then the mood and anxiety disorder piece reminds us that we can be talking about depression. We can be talking about anxiety. We can be talking about post-traumatic stress disorder. We can be talking about obsessive compulsive disorder, psychosis, bipolar disorder. All of those mental illnesses can happen within that perinatal period, pregnancy, and the first year after birth. And when they do, they are very unique, and they're different than when those disorders occur, say, to your 40-year-old man or your, teenager. They're different. They're really specific in how they manifest themselves and all of the other issues that are in play.
Yeah, are the triggers similar for all of these things, because that's a very specific time in life? Is it hormones? Is it circumstantial? A little bit of both?
It is all of those things. Hormones, the hormones that come into play during pregnancy and the postpartum period, of course, those are really unique. You know what? A 50-year-old woman isn't going to have those same hormones. Sure. Your teenager doesn't have those same hormones. Also, the environmental factors are very different. Growing a baby is an enormous thing. It affects your body. It affects your thought process. It affects your priority. It affects your lifestyle. It affects your identity. And all of those things combine in really unique ways that you don't see for someone who has a mood disorder and isn't pregnant or has a new baby. So it means you've got a lot of things happening all at once, and it's really challenging.
So what are some manifestations of these different mood disorders?
So in a lot of ways, they look similar to what that mood disorder would look like if a woman wasn't pregnant or had a baby, but in some ways they're really unique. So one of the things that we often see with depression in the perinatal period, pregnancy and the first year postpartum, is sometimes we see the typical, I'm really sad, I have a hard time getting out of bed, I'm feeling
different
really
than
hopeless.
Just normal pregnancy fatigue. It's different.
Totally different than just regular fatigue. Mm-hmm. With fatigue, when you rest, you feel better. With depression, when you rest, you don't really feel that much better. So there can be some of that. But what we often see with perinatal depression is it's a kind of agitated depression. There's an anxiety component to it.
You know, one of the best things I heard, it was actually during a live stream, someone said that depression and anxiety so often go hand in hand because depression is obsession about the past and anxiety is obsession about the future. And if you're depressed about the past, you'll often worry about the future.
That can be a helpful framework for some people. So for some people, depression is more of just a shutdown. They are not able to really think or about anything. But that is a really common thing that some people find. There's a lot of things
to be anxious about when you're pregnant, right?
There are a lot of things to be anxious about. And not just anxiety, but we often see in perinatal depression an irritation. And a lot of times moms will tell me, I don't feel depressed. I'm just mad. Like there's an anger component, an irritability component that can come to it. They recognize
that's not them.
Right.
Yeah.
They do. So that's one way that's unique to that time period is depression may look like what we stereotypically think of depression, but it also might look a little different. Anxiety looks a little different as well. You can have the worry, and moms typically are worrying about their baby. Health concerns become a big, common worry. Moms will be like Googling every little thing about themselves or about their baby. So obsession about health is often a unique part of perinatal anxiety. That kind of anxiety can also move into, say, an obsessive compulsive type thing. And when you experience that regular obsessive compulsive disorder, we think of things like having thoughts we can't get rid of, having to have rituals and checking to make us feel safe. And that can exhibit itself in the perinatal period, but it's usually focused around baby. Intrusive thoughts are also something that are really common with our perinatal moms that you not so common in, say, the general population. And those are thoughts that just pop into your head. You're minding your own business and they pop into your head. And with our moms, they are often very, very distressing. They're related to the baby. Many moms have told me it's almost like I can see this happening. And the thoughts are usually having to do with something bad happening to the baby, or mom doing something to the baby, or an accident happening to the baby. And moms get really afraid of these because they think, I'm going crazy.
Yeah, I'm glad you're bringing it up because a lot of people have them, but think that they don't have to label themselves as being crazy, or they don't have to think that they need to be like that for the rest of their life.
Right. And it also doesn't mean that they are going to hurt their baby. Mm-hmm. You know, there's some pretty scary stuff in the media about moms who, in a postpartum psychosis episode, have done some really difficult things, really tragic things. And moms can worry that that will be them. Or they'll worry, if I talk about these feelings I have, these thoughts that I have, people are going to take my kids away from me. Mm-hmm. They are going to think I am not fit to be a mother. So it's really helpful to know that that's a common thing. And one of the ways you can kind of discern, am I in trouble or am I not, is how do I feel about these feelings? Do they make sense to me? Does it make sense to me that I would need to harm my child? Or am I completely freaked out?
Yeah, if you're freaked out by it.
If you are freaked out. So the term in the psychology world is ego dystonic, meaning you are not okay with these. They don't make sense to you. You're really upset about those. And that is a really good indication that you are not going to harm your kid. That this is a thought disorder that can be really easily treated. Easily. I use that term relatively. One of the cool things about perinatal mood and anxiety disorders is that they are really treatable. We can make a lot of headway with them in a relatively short amount of time compared to mood and anxiety disorders in the general population sometimes. So getting help can be really hard because, as we pointed out, you've got this whole new phase of life. You have this new person to take care of. You're adjusting to all of these things, both external and internal. And the last thing you want to do is go get some help.
Yeah.
You don't have time for that. So sometimes it's encouraging to know that getting the help will set you on a path to recovery and that you can be well. You can be yourself again. This is not a permanent state of being. You can get through this, and many, many moms get through it. And it's not something that becomes the rest of their life. And it's such a common thing. The prevalence of mood and anxiety disorders, the American Academy of Pediatrics has declared them the most undiagnosed obstetric complication in America.
I believe it.
They happen at a rate twice that of gestational diabetes. And
we screen everyone for that.
You screen everyone for that. Everyone
knows about the nasty
drink, right? And
why not
this happens twice as much.
Yeah.
That is my dream in life, is that every woman who is pregnant or in the first year after giving birth is screened every time she sees a medical provider for herself or for her child. So we can catch a lot of problems then, and then we can make them better.
So speaking of that, if it often starts during pregnancy, it's really important to catch it to prevent postpartum depression, because there are things that can be done to help prevent it, right?
Prevention is a strong word, because we can't promise a mom that. We can't say, we see you have some risk factors. We see some things are happening in your pregnancy. If we put some interventions in place, you will not develop this. We can't promise her that, but we can promise her that we can help build a support system for her and give her education and give her the very best chance of making it through this period, feeling good about herself, feeling good about her mothering, feeling good about her baby. We can absolutely promise her that.
So what does it look like to get treatment? If someone's recognizing these symptoms in themselves, what might treatment look like for them? What could they expect? Where should they start?
Yeah, those are great questions. So it helps to think of things in terms of severity. And one framework that I love, which was actually created by an Intermountain colleague of ours, Jesse Ellis, at Utah
He's
Valley
great.
Hospital.
We've done a live stream with him before.
Jesse's been here before. And he created, in collaboration with other Intermountain social workers, a kind of a red light, green light, yellow light scenario of here are some symptoms, and let's talk about them in terms of severity and then what you do about them. So green light symptoms would be things like you're still in your first 2 weeks, and you're feeling tearful and you're really tired and you're having a hard time, but you're still within what we consider the baby blue period. You're still able to sleep. You have a support system around you, but you're starting to have a hard time. And the interventions for those that are most helpful are some psychoed for yourself. Learn what is normal for this time period. Learn what isn't, so you can start to recognize it if things start to get worse.
And risk factors. It's important for people to be aware of risk factors as well. What might those include?
Well, risk factors is a long list. Do you want to go to risk factors, or do we want to stick with
You can finish
red light,
this if you
light?
want.
Okay.
I just think it's important, too, for people to know, I should really watch myself because I have these risk factors.
Gotcha.
Too,
and risk factors can be part of understanding that psychoed piece. So the risk factors, and it's really, really important to clarify that having risk factors does not mean you're going to develop a perinatal mood and anxiety
If someone has
disorder.
anxiety, this may give them anxiety, thinking, if I have this risk factor, I'm going to get it. But that's not the case.
We can't make any promises for that, because this is such a complex issue with so many inputs to it. We can't make any promises about that. It's kind of like if someone has some risk factors for heart disease. We can't promise you you're going to develop heart disease, and we can't promise you you're not going to develop heart disease. We can say, here's some education. here's some things to be aware of, and let's do what we can to counter the risk factors we can. Let's put in protective things. Let's do the best we can. And the preparation will make it so much easier if this develops. So some of the risk factors that are important to think about are a previous mood or anxiety disorder. If you have had anxiety since high school, that's something to consider. It's highly unlikely that the anxiety you have had since high school will automatically go away.
Yeah, because even if you haven't had a history, pregnant, you have more factors to increase anxiety naturally.
Right.
Yeah.
So if you've had a previous mood and anxiety disorder, that is something to be aware of. A family history of perinatal mood and anxiety disorders, even if it was undiagnosed. So if you're like, oh, my mom has said she had a hard time after her kids were born, or my grandma couldn't take care of her kids right after they were born. These are like family stories that we hear. And so because it's relatively a new thing, you and I were talking about how 5 years ago we wouldn't have this conversation. But you can ask the questions and get the family history and be like, what was it like for my female relatives after they had children? What were those experiences? And that can kind of help us know if there's been a family history there. Sensitivity to hormone shifts. Women who are very sensitive either to when they started their periods, when they have them, if they have strong reactions during their cycles, that is a risk factor. And a family history of such thing is also a risk factor. So if you're somebody whose period sets her off the rails, right? Yeah. Your whole world changes for a certain period of time. That's a risk factor to know about. And some other ways you can kind of identify that is if you went on birth control, hormonal birth control, and if you had a reaction to that, if it made you depressed or whatever, those are just risk factors. This is all information. I like that you
said that because I remember 18 years ago, I went on birth control, a certain type, and it made me crazy. And I think my husband probably wondered for a little while what he'd gotten himself into. And I knew that wasn't me. So I went to the doctor, got on something different, totally changed me. And I can say I don't think I got postpartum depression. So like we're talking about having risk factors, it's not an absolute.
It is not. And I think risk factors are important to talk about. I also get nervous talking about them because you
don't want people to fixate on that.
I don't want a mom to be like, oh my gosh, I have all these risk factors. My life's going to fall apart.
Right.
It's not what this means. This is information. Information is power. Other risk factors, if you've had trauma in the past, trauma in your personal life, or trauma related to miscarriage or difficulty conceiving or loss of a child. If you've had a NICU baby in the past.
That's huge.
That's a big one as well. Social factors, not having good social support through your partner or your family or in your community, being in a domestic violence situation, poverty, stress, a recent move or a recent loss, being a military family is a risk factor.
And even just working in Provo, I saw a lot of girls who were here temporarily because their husbands were going to school. And then I can't even tell you the number of times I heard that like their husband had already moved, started a new job, and then he came home for the delivery because she wanted to finish out her care here. Maybe her family was going to be here for the delivery. And then 2 weeks after the baby was born, they were moving across the country. Yeah. And I would always spend time talking with them about this. Please watch yourself. These are the signs. This is what you should do because those circumstances are already difficult, and having being a new mom is difficult. So watch yourself.
And like exactly like you said, information is power. You may be just fine, but knowing this is something I need to work on maybe, or put some protective things in place, it's only going to help. It's only going to help.
What might some of those protective barriers be for someone?
So a lot of the risk factors we've talked about so far are things that are out of a mom's control. She can't do anything about that.
Yeah, what can you do?
Yeah. So other risk factors are a culture of perfectionism. If you are a perfectionist, if you are a high-strung personality type, that is a risk factor. And that is something that is within your power to learn new ways of thinking, to learn how to kind of view life in a more nuanced and moderate way, to work on some of those cognitive patterns that contribute to your perfectionism or to being high strung.
Or expecting life to be the same after you've had a baby as it was before. There's an adjustment period.
Yeah. So I think that is a really powerful one, is to recognize in yourself, I have a tendency to see things black and white, or to catastrophize, or to, make sweeping generalizations about things. How can I work on that? And in therapy, we do a lot of that, working on changing how we view the world, and that changes how we experience the world, and that changes how we respond to the world. So that is really something that moms can work on. Complications in pregnancy, birth, and breastfeeding is also a risk factor. Now, a mom may not be able to have any control over those, but she can gain the knowledge and the information and learn and think to herself, okay, if I'm having a hard time feeding my baby with whichever method I choose, where are my resources going to be? And if you identify those before it happens, then it's easy to be like, oh, I'm struggling, but I already know. I already know I can call these people.
Reach out to this lactation specialist. My pediatrician's there for me. I have a friend who had problems. She can give me some personal perspective on it.
Right. Exactly. Or, I'm having second thoughts about whatever I'm choosing. So those are some things. Pre-planning can really be helpful. Age-related stressors. If we're older than usual, younger than usual, those can be risk factors as well. We can't change them, but being aware of them can help us put some more support in place. Support is huge. Moms who have a community that has their back, their partner, their friends, their family. So one of those things that moms can work on is the idea of, I can have people help me.
And accept help, too. Some people have a hard time accepting it, and it may be there for you, but you've got to accept it.
Right.
Yeah. So back to the red light, green light thing, the symptoms that people are looking at. So green light symptoms are basically like what you're experiencing is, it's very normal to experience during those first couple of weeks postpartum, or it's something.
Still hard.
Yes, still hard. Don't want to discredit how difficult it is. But then what about like yellow light symptoms and red light symptoms, and what should you do with it?
So yellow light symptoms would be things like, I'm outside of that baby blues period, which is about 10 to 14 days. And I'm still feeling really, really moody. I'm just having a hard time settling and controlling my moods. If you're not sleeping, if you're unable to sleep when baby sleeps, if baby is not letting you sleep ever, that's not getting sleep is huge.
Oh, it is.
That's one of the most important preventative things we can do for moms, is to figure out, how am I going to get the sleep we need? And we actually know the bare minimum for that to protect our brain health. And it is a 4-hour uninterrupted stretch every 24 hours. So that's our goal. That's our ideal, to hit that minimum.
And it's going to require some help to get that in the beginning.
Right.
And this is where I say, dads, you can step up.
Dads can step up.
Yep.
Family members can step up.
Yep.
Friends can step up. But underestimating the importance of that has gotten more moms in difficult situations. That's not a lot of sleep.
That's not.
That is not a lot of sleep, but that minimum helps you kind of keep your head above water.
Yeah, because everyone knows when you get tired, even a little tired, you get more emotional. And in that circumstance, everything is just going to be magnified. Yeah.
Right?
Mm-hmm.
Yeah.
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 So, are there any other yellow light symptoms, or?
So if you start to have some of those intrusive thoughts that we talked about, thoughts that some harm is coming to your baby, or that you're gonna do something to your baby. If you're having some of those intrusive thoughts, once you've hit into the yellow area, that's a great time to get a second set of eyes on the situation. Call your OB. I call a mental health professional who specializes in maternal mood disorders. That's really important because, as we've talked about, you treat these differently. Mm-hmm. So a therapist who isn't familiar with them, may not be able to be most helpful. They may not understand
group around here too, because you guys are great resources for moms.
They may not understand that intrusive thoughts are relatively common. Mm-hmm. Mm-hmm. Mom comes, talks to me about that. I am not going to freak out. Mm-hmm. We're going to talk about how we deal with those, how we handled those, and I'll be able to reassure her. So a second set of eyes when you move into that yellow category. If your friends or your family members start expressing that they are having some concern about you, that's moving into the yellow category. If you find you can't let go of your anxious thoughts, or you find you're having a difficult time wanting to interact with your baby, wanting to care for your baby, that's a yellow area. So let's just get a second set of eyes on it. In the green area, you're going to want to do a lot of education of yourself. So there's a lot of great websites. Postpartum.net is the website for Postpartum Support International. They are the worldwide leader in maternal mental health. They have a lot of information resources. They have a lot of online chats that you can sign up for and online classes you can listen to. It's a great resource. The Healing Group is a great resource as well. And Intermountain has some good patient education materials as well. So getting educated is that green category. The yellow is get a second set of eyes on the situation. Figure out what's going on. Really start to put into place those things like making sure mom is sleeping, making sure mom is eating.
Eating, yeah. You start to let self-care fall to the bottom of the list, and if you start to eat and sleep, then that can help a lot.
So much.
Yeah.
So much. Just those things can be really, really helpful. Mm-hmm. And sometimes moms can feel like I have to be there. I have to do everything for my baby. I have to be there for my baby 24/7, and I'm not going to do anything but take care of my baby. Well, your baby needs you, and your baby needs you to take care of you.
Mm-hmm. You're not going to be worth much if you continue on that.
You really aren't.
A while.
You really aren't. So red, that is when you need a second set of eyes on the situation immediately.
So this means like going to the emergency room.
That means like going to the emergency room, or if you can get into your medical provider that same day.
We're not talking about waiting more than a day.
We are not talking about waiting more than a day. We're talking about this has hit a critical point, and we are concerned about safety.
So thoughts of hurting yourself.
Thoughts of hurting yourself.
Or someone else.
Or someone else. If you're having...
different than intrusive thoughts.
Different than intrusive thoughts. If you are having thoughts of hurting your baby and that makes sense to you, either because, and the common storylines that we often hear with this is moms will start to believe that their baby's better off without them, or there can be some delusional thinking. This is what God has told me to do. Those are the common storylines. There can be others. And sometimes mom is not going to be the most objective judge of those. So family members, friends are really important. Partner. If you see any of that, you need to get a consultation immediately, even if it tends to ebb and flow. If you're like, oh, well, she was having a hard time this morning, but now she's fine. It can do that. It isn't a consistent thing all the time. So you need to get a second set.
Once it's even popped up its head, you need to address it.
Exactly.
So once someone seeks help, medication, therapy, what can they expect for treatment? And I'm sure it will depend on the severity, but.
Exactly right. It totally depends on the severity. And so working with a provider who understands how to help women is really helpful. The gold standard treatment for any mental health is, the appropriate medications and the appropriate therapy. Moms are often concerned about going on medications because they're like, oh, I can't breastfeed or this or that. And that's not always true. There's some assumptions that people make there, and you can be on medications and make the choice to breastfeed your child. You can be on medications while you're pregnant. You need to weigh the costs of treatment versus not treatment, because not treating when you're in a situation like this has effects on your baby, has effects on
Definitely.
you.
Mm-hmm.
So you have to weigh that out. So talking that through with a medical provider, with a therapist who knows what they're doing is really, really helpful. Therapy's wonderful. Support groups, wonderful. Some moms find that a support group is all they really need. And the healing group, we offer 3 support groups every week, one in our Park City location, one in our Midvale location, and one in our Utah County location. And those are completely free. Sometimes individual counseling is really helpful. Sometimes counseling plus a group is really helpful. And then sometimes we need to add the med piece in as well.
And so I think the key message here is to watch yourself, know what those red flags are, whether they be risk factors or things you're actually experiencing. And hopefully people know more of where to get help and what that's going to look like. And in the end, there is hope. There's light at the end of the tunnel. It doesn't have to be like this for the rest of your life.
This is, for moms who are dealing with this, it is not their fault.
That's so important to understand.
They are not to blame. They've done nothing wrong. Mm-hmm. There is likely not a lot they could have done to prevent this because of how complicated and all the factors we've talked about.
This is important for partners to understand as well.
It is. Mm-hmm. It is.
Is there any therapy for partners?
Yes. In fact, it's really interesting. You mentioned that we're learning that postpartum mood disorders can affect dads as well, up to about 10%. And if their partner is experiencing a mood disorder, dads or the non-birth partner has an increased risk of that as well.
When we talk about support being so important, mm-hmm. if you feel like your support structure is crumbling, whether you be the mom or the dad, mm-hmm. it's going to put you at greater risk.
Yeah. We actually have a group at the Healing Group for dads.
That's awesome.
It's run by Braxton Dutton, our one of our therapists there. So yes, dads, of course, or the non-birth giving partner, whoever that may be, may need some help too. But the big thing we want moms to know is this is not your fault and you are not alone. And with the proper help and treatment, you will be well.
I think that's the best place we can end at. Thank you so much, Reva, for being with us today. And of course, if you guys want to hear more from her or look into the Healing Group, what website can they go to?
So thehealinggroup.com. I'm also on Instagram at Reva Cook, LCSW, and I can be reached there as well.
Awesome. Thank you so much for being with us today. And of course, you guys know where to find me on Intermountain Moms. Thank you so much for joining us and have a great day.